Morning. It seems that there is little we can agree on in this very polarized world except this. 2020 has brought with it some unimaginable challenges. It's brought heartache and loss to thousands of families. It's divided a country between those who believe in science and those who do not want to do all that is possible to keep this virus from infecting others. Hospitals are dealing with a virus they knew little about when 2019 turned into 2020. ICUs are packed with very sick people with a very contagious disease. A weak federal response prevented containment. A patchwork of protocols from state to state and county to county has not been an effective way to respond. Civil unrest joined the pandemic following the horrific killings of George Floyd, Breonna Taylor, and other Americans of color. The killings and the pandemic both highlighted the inequities that divide us and create a country of those who have and those who continue to be denied access and opportunity. The talk of a vaccine has brought us hope that we can finally eradicate this deadly virus. Our healthcare workers and residents of long-term care facilities could be getting the vaccines by the end of this month. But the process of wide distribution will take several months. We look forward to finding out from the state the details of the vaccine distribution. The hospitals will vaccinate their workers. Our nursing homes and other long-term care facilities will partner with pharmacies that they already have a relationship with to vaccinate the residents there. Our Department of Health will be in communication with these facilities through a high-risk task force to make sure that these residents are protected. Our Department of Health has been doing a tremendous job of responding to this pandemic. Like our healthcare systems, the department is strained, with our employees working overtime and doing all they can to keep our community safe. Our public health experts here and across the country have taken heed, but they remain calm, focusing on what is best for everyone. The health department does not have a staff to be the main or the only agency to administer the vaccine. In the spring and the summer of next year, the department will have a role being among the clinics, doctors' offices, and pharmacies that give the shots and working with local partners to assist in the vaccine delivery. The health department is currently working on an outreach program to ensure that our most vulnerable residents understand the importance of getting the vaccine and that they have access to the life-saving measure. We have acquired 3 more ultra-cold stand-up freezers to hold vaccine doses, roughly about 76,000 doses. We have experience with these freezers, and we have been drilling on the management of the ultra-cold supply chain. We are also finalizing an agreement with a local company to lend us 2 additional ultra-cold freezers to serve as backups and to have an alternative storage site. We're doing all we can to be ready when the vaccine comes our way. Hope is great, but patience is critical. Until a vaccine is widely available, we have several months from now, it's important to practice the protocols put in place to protect us all. We've seen the daily numbers of cases drop a bit, and we are heartened by that. This is an indicator that the additional steps we have taken in St. Louis County to stem the tide of the virus are working. But we don't want to overinterpret these numbers. We have to look at several indicators over a period of a few weeks to have a true measure of how the virus is moving in our community. We still have too many sick people in our hospitals. The pandemic task force reported yesterday that staffed hospital bed capacity is at 83% among the major hospitals, and the ICUs are at 90% of their total staffed bed capacity. We must provide a relief valve for our hospitals. Flu season is coming, and that will mean more sick people. It's absolutely crucial to protect our hospitals because they protect us. Please stay the course, avoid crowds, stay home whenever possible, and wear a mask when you leave home. Postpone your holiday travel. We are not passive bystanders. We must have enough people doing the simplest things to make this go away. I'd be happy to take any questions.
I just have one as a clarification. I don't know that you know the answers to. When do we think we're going to have the vaccines here for the hospital workers and for the nursing?
So the question about when the vaccines will arrive for hospital workers and nursing homes, We believe that the vaccine shipments will arrive in our community by the end of this week. There are some logistics that need to go into place. They will arrive to our hospital systems, and they will begin the process of distributing them to their hospital workers. There will not be enough in the first shipment to vaccinate all of the hospital workers. They will be vaccinated in shifts, and the hospitals will decide on who is the priority. We expect those to be emergency room doctors and nurses and ICU doctors and nurses, the ones who are seeing the most COVID patients. But over time, over a period of a month or two, we hope that the hospitals will be able to vaccinate all of their doctors and nurses, respiratory therapists, and other staff that are on the front lines and taking care of some very sick people that are fighting with this pandemic. As far as the nursing homes, our long-term care facilities, they all have contracts through national pharmacies, and those national pharmacies will be distributing the vaccine to those long-term care facilities, and they will make sure that those residents and their workers in those facilities are vaccinated. We will be monitoring that distribution through those facilities. We have a high-risk task force that we formed at the very beginning of this pandemic to make sure our long-term facilities, nursing homes, residential care facilities have the resources that they need to take care of their residents, and we'll be monitoring to make sure that they have access to the vaccine. Any other questions?
Okay, thank you.